That
Good afternoon, everyone. It's always a trick getting the screen to stop sharing without continuing the music or the speaking. Hello, everyone, and welcome to the Self-Sufficiency Partners Meeting. Before we get started, I did want to remind everyone that we do record our meetings, and so that recording will be starting here shortly. The purpose of this recording is so that folks who want to revisit some of the subjects today, or if they were unable to make it today, they have the opportunity to still be a part of the meeting and get the messages that we need. So I hope that is okay with everyone. But if you do have concerns, you are welcome to reach out to me, and we can talk about those as well. So I will put my contact information in the chat here shortly. In the meantime, if you would introduce yourself in the chat, that's really helpful for everybody here so that we know who's here. Introduce yourself, pronouns, position in the organization that you are with. Thank you. And yes, Vanessa is here. Vanessa, did we talk about an announcement you needed to make today? I can't remember, but I want to give you time if that was for today.
I don't think so. I think the only thing we talked about was like some SNAP updates, but those are on the agenda for today, I believe.
Perfect. All right. Well, great. I think what I will do then is go ahead and hand it right off to Nate. I see his lovely face on the screen. He's our first presenter. So Nate, take it away.
Thank you. And I will take a lovely face comment anytime, because that is not the reaction I always get. So appreciate being with everyone today. I'm going to jump straight in because got a little bit of a different PowerPoint we will share out with you today with quite a few different details and updates as we move through things. But again, for those that may not know me, I'm Nate Singer. I'm the Oregon Eligibility Partnership Director with the Oregon Department of Human Services, and I use he, him for my pronouns. So around one in eligibility, customer service, different enhancements or things happening. Not going to go through some of the programmatic, but want to talk about a couple different things that are out there that you may start to hear around. The first one is the launch of the Oregon One mobile application. We are currently not doing a big press release, information, talking heavily about it yet. It's not advertised in our offices or other locations. That's my preference, is trying to go slowly out there as we do these things, make sure it's working. So we have released a mobile application. This mobile application allows you to ask questions, get reminders about information, so you can know if you have appointments, something's coming due. You can see your notices on your phone. You can upload documents by taking a photo of the documents, so that way you can, when you have that notice that says I need to provide a copy of my pay stub, I can take a picture of it and automatically uploads it to one for a worker to be able to then process off of, and just really let them keep track of what is due and what their redetermination of benefits dates are. So this is the first phase of us jumping into this. We'll be doing another update next month as we continue to build out the functionality around the mobile application, but it's available for Apple and Android users out there. Just from a quick statistics, without advertising it, but because I like to always look and be aware of what's happening. Interesting enough, there have been around 1,100 downloads thus far with about 500 unique users. So I downloaded it, so I count as a download, but I'm not a user because I'm not receiving any of the benefits through the one system, so I can't see actually how it functions. I just wanted to see if it actually would download. So look there. We have over 34 different racial or ethnic groups or individuals or categories that individuals are using it under, so a spread across there. The median age is between 30 and 39. We do have one person over the age of 79 using it from our age categories as we look across there. And Yeah, so we'll continue to look at opportunities to look at data and the rest with this, but it's a great opportunity for people to submit documents to us and provide updates. It's something that community partners can utilize as well, and working with individuals, those as you look at helping people with their application assistance and other ways. The other thing that we've rolled out is text message reminders. So as we look at opportunities there, we are sending out text messages to keep individuals aware of what is happening around cases and other information. So as individuals have opportunities, we're really encouraging for them to put if they receive text messages or put email addresses or voicemail options into their accounts, because we'll be doing more and more to automate that. So that way we can automatically let people know, hey, we got a piece of mail returned to us saying your address. If you've moved, can you update your address for us? Giving a link so they can update and provide that information, reminders of when their appointment is, other pieces of information that way. So right now, those are only in English and Spanish, but we are looking at ways to try to enhance that in the future and provide more of those as options as we look at doing this work. A couple other tools just to make sure you know are out there, and we send the deck, you can see links to get to these. As we look at things with the public health emergency unwinding and doing medical redeterminations, all the changes we've had around exemptions for college students with SNAP coming up, emergency allotments ending, and really having to re-begin the able-bodied adults without dependents and those requirements. We've created a number of change tools that providers can use and advocates can use. So you can find these on our PHE Unwinding websites. And so they just have tools to describe what the changes are, what the flow will be, and other key information. So that way, help people understand what they will experience during the renewal process as these different changes occur. The next thing is notice resource guide. So this is one of the other areas that we had. We took some of our more common notices and created some tools that community partners can use to help individuals support them as they are going through the notice process. We know oftentimes they come to you all in the community and look for answers around what do these notices mean as we try to balance meeting legal requirements. I already saw Beth was on here, and so others of our legal advocates out there, balancing that legal requirements with plain language areas. It is a difficult thing to try to balance and find the right balance as we move through this. And so one of the things we tried to create for individuals were notice guides that don't supplant the actual notice itself, but help individuals describe in this section of the notice, this is, what's happening here. You need to look to this section of the notice for those areas. And so a way to be able to help direct individuals and provide some greater context. So that's one of the tools that the Oregon Health Authority and Department of Human Services put together. And again, it can be found on the website when we send out the information. I'm gonna move through so I can get to questions. So I'm gonna move through this quicker here. We are doing redeterminations for medical. We're doing it for all other programs. As you look at these numbers and look at the monthly numbers there, these are the individuals that need to be redetermined every month. These do not account the additional redeterminations for SNAP, periodic reports, for temporary assistance for needy families, TANF, for SNAP is Supplemental Nutrition Assistance Program, and employment-related daycare or childcare benefits. Those equate to about, on average, an additional 80 redeterminations or reviews that we have to do every month. And it's important to note, medical are our most automated of our redetermination renewals. So those other renewals, when we add on top, really are a lot more of our manual work where we require interviews federally and where we have to engage with individuals to collect all the information. And so it's a balancing as we move through this. This is a historic level of work, but this website you can now find, or these dashboards you can now find on benefits.oregon.gov. We will be enhancing them. And so between now and in the month of May, we'll do an enhancement, June, and then July to August, we'll do enhancements. At the end of it, you'll have a place you can see our call times. You can see other key information there. You'll be able to see outcomes for redeterminations, obviously not with person level information, but you'll be able to see demographic and other information to know, what are the primary reasons people aren't being found eligible, or what's happening with this, and we'll be expanding it beyond medical so we can look across programs, so that way you can be seeing what is happening a little bit more timely and openly and transparently. Speaking of, as we look into that, we also have on there a dashboard around our call times. You can select the time periods, change inside there, and see the different call times that we have. You can hover above them and see the average wait times, maximum wait times, abandoned calls, and all the rest. And so you can see May 8th, for example, here was one of our highest call volume areas, over 6,000 calls received, or attempted calls were brought into us, and what percentage were really able to answer. And that's pretty consistent across. While we see the other numbers go up and down on total numbers, how many we can answer is a pretty consistent number as we look at our work and where we are staffing. As always, we try to report out what we have for our wait times. Again, these wait times include individuals that have chosen to use our virtual hold. So they're not necessarily always on hold during the maximum wait time, but I always want to present what it was. So in our eligibility queue, someone waited over 2 hours for us to call them back in this situation, and then begin the eligibility process from when they first engaged with us. Our average call times you can see over there. We have been getting assistance from a contractor, PH Tech, and so there are times that if you do call in, you might be working with a contractor that then has to send you to a state staff person under federal law to process some of this. Here's some additional stats on number of calls and the rest, but I want to jump in and really just spend just a minute on the public health emergency unwinding, just general updates there. So tonight at midnight, the public health emergency ends. And it's been a long couple of years, and there's been lots of changes around this. And obviously, COVID is still out there. It's an area of stress related to individuals and other groups. And it's a time to reflect both on the heroic work of a lot of individuals to help us move through this period of time, reflect on lessons that we could learn through it, and also take pause for the lives lost through COVID. And so it's something that many of us felt personally. It's affected businesses, partnerships, and many of the work that you all have done. And so I just want to take a moment to thank you all as partners for all the work that you have done around this work. We have redetermination information in here. I'm not going to go through that with you today, but it gives you information if it's helpful around what those medical redetermination processes will be as we move through it. Again, there's a number of resources around there as you look for information. One of the ones I did want to call out is the Need Food Oregon Toolkit. As we look towards it, and I know Vanessa has several updates around food benefits and SNAP changes and things happening there, but we know nationally as ABOD requirements come back in, as emergency allotments end, and with where we are as we look at an economy, while things are stronger than they have been, we're seeing the signs that lead towards individuals having greater food insecurity. Fair Borders, our ODHS director, was recently in Washington County with a great partnership with partners there, visiting and looking at a free food market that they put on for individuals. And he said there were over 200 individuals in line waiting for that opportunity. And that's just a slice of a market and group at a moment that really need these additional securities and groups. And so this toolkit here is one of the campaigns we've done before. And really the goal is to describe all the different avenues and partners and ways to communicate and find information. So it's a great thing for individuals that may be going through this, and coming into an ODHS office is not always the most comfortable experience, coming to partners and the rest, and so really identifying the work you all do and some of the resources that can direct them to you in your communities. So with that, always more resources the rest, but I want to just pause because whenever I share the screen, I have no idea if you put anything in chat, and I'm already over my time. So I will see if there's any questions or anything I need to answer here.
You are not over time. You have a whole 5 minutes for questions.
That is amazing. I never do that.
We did have a question in chat around text messages. Does it add a note to the case?
So it doesn't. Ooh, I am not sure. I will need to check on that, Erica. I see the note in the chat there. I will take an action and I will get it back and we can send it out to the group as an answer. Whether it's doing that, I don't believe it does, but we are looking at some ways to update that. This is more of an internal thing than some of our external, but we are rolling out a tool to staff. It's joyfully called Note Buddy. I always love when staff get to help build things and name things. So it was a staff-led initiative to really build out a tool that helps and can automatically put in notes into the one system and to keep things more consistent around that. And so I will find out if at all these are connected. Oftentimes when we do these automated things, there is an automatic note put in one. So that way they are aware, but I need to find out.
Thank you, Nate.
Any other questions? I want to spend just a quick second, with you all for anyone else to throw anything else in there, seeing messages. What is the link for the food services assistance again? In our PowerPoint we send out, we'll send out the link for that. Andrew, I believe you're on. We'll send that out and those will have all the links in there. And I think that'll be the best way to get those links out. As you do get a chance to look at those links, on the PHE website, there's a great one that talks about all the ways you can engage with us and connect in with the department. I always want to emphasize, because I hear a lot, and from Erica, from your question, calling the VEC or 800 number, that's one of the paths, but you can go into any of our APD, SSP, or AAA local offices. And I always just want to make sure people know that, because we serve a lot of people across ages. And while it may not always be the most comfortable, it is an avenue. We also have application assisters with the Oregon Health Plan, and we're looking at ways, again, hopefully to partner with many of you all in the future to see if we can find a way to fund or stand up a system to allow us to have community partners be able to help people submit applications throughout, because many times you all are already working with these individuals and have to direct them to our offices, and the comfort language, so many different things. It's much more effective when individuals can work and partner with people in the community. So hopefully we'll see some things there. And Vanessa already put it on there. You all are amazing. I should shut up more and let you all talk. Beth, you have your hand up.
Thanks, Nate. Just a couple of super quick questions. One, do you know when the things will be added to that dashboard? Like how many people have successfully been redetermined, or how many people have been terminated, et cetera? And then the second part of the question is, with the call, you're tracking the call wait times, especially, which is really great and important. I'm wondering, are you tracking the calls that do get answered by language, like how many people who speak languages other than English are calling, and if the wait times are the same for them, or how that's all going?
We are. And so for both of those, I can send out to the group only because I'm sitting in our office and it's right across on someone's wall here, the updated dates for it. So let me send the dates and some high level what they're going to put into each of those builds. For the dashboards. Right now, the dashboards will tell just for medical, but does tell us if they completed a redetermination. And we do have those that receive termination notices. Please note that no one's been terminated yet. I'm sure there's an outlier, someone's withdrawn or something that way, but they've received the notice of it. I was a little hesitant because oftentimes termination notices is when people then fully engage with us. And so we've seen scenarios where those numbers have already dropped down in the first month. And we're seeing it again through passive renewals. As we move through it goes up, and then people get that notice and feel more angst to say, wait, I don't have a second house. Sorry, that's been on my application for, I don't know, 3 years. That was a real scenario that we just worked through with someone going, great, you're eligible now. That makes so much more sense for your situation. But really is trying to engage there. On the phone parts of it, we do have that information. We're building out that dashboard a bit more. Part of what some people may not be aware of, the state as a whole, this is not something I wanted to do, switched our phone vendors. So DAS has a contract for all state agencies. And so we are in the middle of switching in June, most likely, to a new phone system. So fingers crossed. But it will give us an opportunity to get more data as we move to it. So that's delaying some of our phone information coming in there, as we have to switch over to the new phone system and do that. So that will take us through the beginning of 2024 to get all of our offices onto it. But as we do that, hopefully we'll actually have more information on this. But we do know where we're having in there. One of the things you all might hear from partners in an area, please feel free to reach out to me. My information, I think, is in the PowerPoints. Find me all over the place. If you hear about these, because I am trying to personally intervene in some of these situations, for those that have other language needs, as we work through this, they can directly call. This is one of our enhancements, one of the interpreter lines, and those interpreter lines directly call in. And it's not that they move to the front of the line, but they move to the front of the line. It directly connects in there because we have an interpreter on the line. We don't want to wait for any of those period of times when we have them connected. We've heard some issues with calling the interpreter lines, the interpreter's not answering. And so the individual is then stuck and basically gets dropped off because of that. If that's happening, please let me know. We've been talking to it. And if you all are having any community experiences, I do want to hear those. It's always helpful for me. So more to
Thanks,
come.
Nate.
I'll send some details out.
All right, thank you. We do need to go on to our next presentation, but if you have any more questions for Nate around these topics, feel free to put them into chat and we'll make sure that we get them addressed. And I did see that Jen is here. There she is. It's all yours.
Good afternoon, everyone. I'm going to share my screen here, so I'll just wait until I get confirmation from you all that you see something.
We see it.
Okay, perfect. So good afternoon, everyone. My name is Jen Eras. I'm a childcare policy lead with the Oregon Department of Human Services for about the next 2 months. And then I will be moving over to the new Department of Early Learning and Care. So with that, I'll just kind of segue into the reason I'm here. Basically, I'll be sharing a little bit of information about the employment-related daycare program and what changes we have kind of coming down the pipe in the next couple months. And just as a quick overview, I know I've shared a lot of information here before, but the employment-related daycare program essentially is a childcare subsidy program. So we make childcare payments on behalf of the family to the childcare providers directly. And so this decreases the cost for families. And in many cases for the program, we actually have families who have a $0 copay. The copay is their portion of the childcare subsidy that they would pay to the provider directly. So it's either very low or no cost for many families. The employment-related daycare program, not to let the name trick you, but it actually does help cover childcare for both families who are employed or attending school. And we'll also have some expansions into covering other ODHS approved activities. So starting July 1st, we're going to have a pretty big expansion of the program where employment-related daycare will actually become the child care program for TANF participating families. So previously we had a TANF, or currently we have a TANF jobs program that is another child care program that runs in conjunction with the employment related daycare program. But come July 1st, all child care for families, both working and going to school and participating and receiving TANF, will be able to get childcare through ERDC. So I'll get into a little bit more detail of that in the future. We have another slide a little later that goes into more detail on it. So essentially all of this is happening because back in the 21 legislative session, House Bill 3073 passed the legislature, and that created the new Department of Early Learning and Care. The Department of Early Learning and Care is actually pulling together some existing pieces from two separate agencies, and also there will be some new pieces that will be added in. So right now, the federal funding source that we have, it basically ends up splitting into two agencies. So we have a portion of it that goes to the lead agency, which is the Oregon Department of Education, specifically the Early Learning Division. And that funding goes to basically maintaining our childcare licensing system. But then there are other programs that are under the Early Learning Division, like Preschool Promise and Oregon Pre-Kindergarten. They also have policy and research teams, as well as an equity team that will be coming over to DELC. Within the Oregon Department of Human Services, we have the child care subsidy portion. We also had inclusive partners, but they migrated over to ELD last year. And then the ERDC child care program will be moving to DELC. However, eligibility is going to remain at ODHS. So families will not see a difference in how they access the employment-related daycare program. It will still be in the 1IE system. So we'll be able to take advantage of the wonderful app that Nate was talking about. But families really won't see a whole lot of change between that. But what it means for Oregon Department of Human Services is some groups, like the Child Care Policy Group, which I'm a part of, will move over to DELC, as well as our subsidy suspensions team and also the direct pay unit. And direct pay unit, they process the child care, basically applications and payments for the subsidy program. We'll also have some new kind of back office and shared services like IT, accounting, HR, and also our project management office. So we'll have those brand new teams that will be under that department. And that will create our new Department of Early Learning and Care effective July 1. Some of the changes that we're going to see with the program, though, we'll have some program enhancements, but specifically to our 12-month eligibility. Just going in the Wayback Machine a little bit, during the 2014 reauthorization of the Child Care Development Fund, our federal funding source, they essentially said that all cases should be approved for a minimum of 12 months. We shouldn't be approving cases for a shorter time period. So we implemented our first attempt at 12-month eligibility back in October 2015. What we saw with that is prior to the change, our families had an average stay on subsidy of about 4 months, which if you think about a child in a child care situation, 4 months is not very long at all. Especially for developing the relationships that they need to and that stability to help them learn. And after we implemented our 12-month eligibility, we saw the subsidy stay increase, but it increased only to about 7 months. So with the passage of House Bill 3073, we were able to really enhance that 12-month eligibility. So right now, prior to July 1, one of the main reasons we see child care cases closing are because families can't find an approved provider, and also because they've lost their employment. We have a little bit of protection for job loss, but it's typically only limited to 3 months, especially if it's a permanent job loss. So with the July 1 change, we'll no longer have cases closing for these reasons. And in fact, the only reasons that you'll see employment-related daycare cases close are if a family moves out of state, if there are no eligible children left in the home, if there's a request to close benefits. Obviously, we can't keep the benefits open if the family doesn't want it. And then also if benefits were determined in error and if their income goes past our exit limit. So our exit limit is currently set at, for most families, it's at 85% of the state median income, which that's a federal limitation, but for larger families of 8 or more, it's actually set a little bit higher than that, at 250% of the federal poverty limit. But that's the exit limit that we have. It's actually quite a bit higher than our entrance limit at 200% of the federal poverty limit. So that allows families to stay on the benefits a little bit longer. And I promised that I'd talk a little bit more about categorical ERDC. So starting July 1st, what we're going to see is that families who qualify for TANF will be able to qualify for employment-related daycare. What it means for families who are currently on TANF childcare is essentially we're going to be transitioning their childcare over to categorical ERDC. Categorical ERDC is 12 months of eligibility, regardless of what happens to their TANF case, and it's a $0 copay. And then also what it means for families who are on TANF but not receiving childcare is that they can apply for childcare at any time. They will still have to complete an application for employment-related daycare, But for the most part, there will only be a few questions that we have to ask to meet our federal requirements. So it's going to be a very, very limited application for benefits. And then for families that are currently on ERDC, one of the big changes we'll see is that they'll be able to apply for TANF at the same time. So right now, current state, we have some rules saying that there are very few situations where families can receive both TANF and ERDC. And this is going to expand that. So essentially right now we tell families, even if you're underemployed, you have to choose between the programs. You have to choose if you need childcare more than you need a cash grant. But come July 1st, families won't have to choose that. If they're under the TANF income limits, they will be able to apply for TANF and receive a TANF grant along with their ERDC. And then for new families that come through the doors, they'll essentially be able to apply for either both programs at the same time, or they can apply for TANF, and they can apply for ERDC at any point in time that they're receiving TANF. So it doesn't have to be right when they first apply. So we are really excited about these changes. It'll bring alignment between the two childcare programs, because the TANF Jobs Childcare Program and ERDC, they mostly aligned when we could, but there wasn't always perfect alignment, which caused confusion for providers and confusion for families. Also, having to switch between the two programs caused disruption in childcare placements as well, where providers wouldn't get billing forms and they wouldn't know what was happening with the payment. So we're really excited about these changes. And just because I love pictures and infographics and things like that, we've got this little example here. So example one, this can actually be two different situations. So it could be a situation where someone comes in and they've been receiving TANF benefits for a while, and they decide a few months into their certification that they want to apply for ERDC. As soon as they apply, like I said, categorical ERDC is a 12-month period. So regardless of where they're at in their TANF certification, the categorical ERDC will be protected, and it will be 12 months with a zero copay. So even if, like say they had applied for both at the same time, this is the other situation this one fits into, and the TANF family, they lose TANF eligibility. It could be because they started working, but it could be for any other number of reasons. At that time too, the categorical ERDC will continue even with the TANF benefits not continuing. The other example we have here is we have an ongoing ERDC family that a few months into their certification, either they lose employment or their income drops. My daughter just handed me an apple, so I'm trying to figure out what to do with that. And so then they can apply for TANF benefits. And once they qualify for TANF benefits, their ERDC certification will be extended out a full 12 months. So even if they were 10, 11 months into their certification on standard ERDC, that categorical ERDC will push that certification out for a longer period of time. Again, we're really excited about these changes. It should mean a lot more stability for families. I do want to note some of the areas where we'll be able to expand on childcare and where it'll be more flexible is that the categorical ERDC is not dependent upon jobs participation. So families don't have to have a jobs plan. They don't have to have activities that are already set out for them that they need to be attending. They don't even have to be jobs eligible. So if we have someone who, for example, if they're not eligible to work in the US, they can still qualify for categorical ERDC. So this expands the childcare to additional families who couldn't access it in the past. We have identified a small gap in the program where, yeah, sorry, hold on just a second. Take that cup. Thank you. Okay. So we have identified a small gap where there are some circumstances in the TANF childcare program where children could qualify without meeting certain immigration or citizenship status. And we can't do that yet with employment-related daycare, but that is a planned expansion for the spring of 2024. And apart from that, we are monitoring the caseload to see if we have any families that kind of fall into this this gap that we've identified. So far, we do not have any families that that would be losing eligibility, and then we're working on an interim business process to look at maintaining benefits or providing benefits for any families that may kind of fall into that gap. So that is what I had. Let me see, I got to get back to you guys. There we go. And I can't see the chat just yet, but I'm hoping.
There's one question, just a clarification. I think, will families that receive TANF be eligible for, it says contract ERDC, but I think they're talking about that categorical ERDC.
Let me see. Well, I mean, we do have some contracted childcare in a few different situations. And so I'd like to hear a little bit more about the question to make sure I answer it the right way. I think if it is referring to categorical ERDC, that's absolutely right. So as long as they're TANF eligible, the families would be able to qualify for categorical ERDC. And again, they do have to submit an application. So they do have to intentionally ask for childcare benefits. The application includes just a few questions that we've got, as well as the interview that they would need to have. And contracted ERDC. So we do have some contracted slots with Head Start, and we also have some contracts that are through the Teen Parent Program. And so with the contracted Head Start, I would have to get back to you on the changes that would happen to the Head Start contracts. That is not my area of expertise, but I know the people who can answer the question. So I can most definitely track down that answer for you and get it to you.
All right, thank you so much for that update. We are into the program update time now. So if anyone has any further questions for Jen while she's on the call, feel free to put those into chat. I'm sure she'd be happy to address those. But I'm going to go ahead and hand it over to Antonio to talk about ABOD. Antonio, are you still here?
Yes, apologies. Let me share my screen and I will go ahead and start it. One second. Okay, let me know once you're able to see my slides.
We see it. Your voice isn't very clear, though.
Sorry, I had this issue last time too. How about now?
That sounded good.
Okay, so trying to. Okay, there you go. So apologies. So my name is Antonio.
Antonio, your audio is I don't know. I'm assuming it's the same for Misha. It's like pretty much unintelligible outside of maybe a couple words that you say at the beginning.
Okay, can you hear me now?
That sounds better.
Okay. All right, so I want to talk about the updates that are happening as a result of what Nate mentioned regarding the public health emergency declaration being done and today being the last day. So one of the things that it's doing for the SNAP program is that it's requiring us to start implementing work requirements for individuals who are between the ages who are 18 but not yet 50, and they have no children in their SNAP case. This is known as having an ABOD status. To offset some of this, Oregon applied for a waiver from the time limits, and 22 counties have been approved to have a waiver, which means that we have 14 counties that we need to provide SNAP time limits. So what Oregon decided to do is that we're going to be providing case management services in 8 of those counties, while in the remaining 6 counties, and as you can see, so these areas in green are the WAVE counties. The areas in blue are the counties where we're going to be providing ABOD case management services. And then the remaining counties in yellow are counties where we are issuing discretionary exemptions to individuals that are eligible for this. So for this group, what's important to know is that there's people who are not subject to these work requirements. The big one that I mentioned was they live in a waived area. And I'm referring to the 22 counties that are eligible for a waiver. This includes all of the tribal lands and off-reservation lands in trust. Also people who have changes where a child under 18 moves into their household and they should be receiving benefits together, or if someone ages out of the group that is supposed to meet the work requirements. And then there is a list of exemptions which people may meet, and if they are meeting one of those exemptions, they're not eligible for or they are not required to do the work activities. So those work activities are basically doing 80 hours of work activities, average to 20 hours a week. And this can be a combination of anything. So working for pay, doing unpaid work such as volunteering, bartering, or participating in a case plan, which is developed through the help the Oregon Employment Department. And so in the month of April, we sent notices to individuals who will be impacted by this change in policy. We sent over 42,000 notices to people at risk. And so in the notice, we're explaining them about this change in rule, what they need to do to communicate to us that they are exempt. If they are not doing work activities, how they can be referred to OED if that's appropriate for them. And this is the list of counties that received those notices. I also want to mention or point out that we in the Oregon Department of Human Services have created a team. The ABOD team is a group of workers who will be dealing directly with or helping out individuals who are impacted by this change in policy, and who will be making referrals to the Oregon Employment Department if appropriate. And so this is the phone number that people can use to call them directly. They can also email them. And as I mentioned, this team will help screen for exemptions, help give credit for any work activities that the person may already be doing on their own, and help with the referrals to the Oregon Employment Department. We do have resources that have been created by our communications team. I'm hoping that Vanessa can put them in the chat if she hasn't already done so. And I want to mention that individuals who are referred to OED will be getting case management services. So we'll have one-on-one contact with a SNAP coach. They will be provided or the opportunity to access training in programs that will help improve their employability. And the plans created will be based on their individual needs, so where they're at. And also those who participate will have access to support services. And I want to end my presentation really quick by pointing out the role that U.S. community partners can play. So we need your help in helping and raise awareness. Something that Nate mentioned is that our relationship to individuals is a little different. And we talk to people, at least for the SNAP program, we communicate twice a year. But there's agencies or community partners whose relationship is more extensive. They see you as someone that they can go ask questions, get clarifying information. And so we ask that you help us raise awareness of the ABOT rules by providing or displaying information about the program, encourage and explain any exemptions or work activities that people may be doing. And some of you might be actually be providing opportunities for people to do their work hours. And then we also have the call out to become a workfare site. So one of the things that I'm going to ask Misha to share is the application to become a workfare site. And workfare is a way for individuals to meet the ABOT work requirements at a decreased number of hours. It promotes community service and civic engagement. And the reason why the hours are lower is because we're basically the rule allows us for people to work off their benefit. The way that workfare hours are calculated is instead of doing the 80 hours a month, we look at what their SNAP benefit allotment is. We divide that by the minimum wage in the county that they reside in, and that's how we come up with the workfare hours. Usually it ends up being an average of 20 hours a month instead of the 80 hours. So I think that's the end of my presentation. And again, I apologize for the technical problems. I usually don't come off camera because of the bandwidth issue. But
Thanks,
notice
Antonio.
that, yeah, notice that my spouse did not have the same problem.
We're going to have to move on to the next presentation. I know that the ABOT information is real important. So if you have questions, please do put them in the chat so that Antonio can try to answer those for you. I also know that a few months ago, we had a lengthy presentation by Antonio on ABOT. And so in our follow-up email next week, I'll make sure that I include information from that presentation as well, because it does go into the exemptions along with a link in case you would like to watch that video if you missed it or would like to review that piece. I do see, Antonio, there's a couple of questions in the chat. So if you don't mind reaching out to Beth, that would be great. But I need to go ahead and hand this over to our next presenter from the TANF team. So Vicki, are you on?
Hello all, I just wanted to give a brief update about our clothing allowance payment. It will be going out for TANF families that received TANF in March of this year in the amount of $270. There's approximately 19,897 Oregonians that are going to receive that. And we're anticipating it to go out on or around May 12th. And so I just wanted to let everybody know that is coming up. That's it.
Thank you, Vicki. Does everybody know what the clothing allowance is that Vicki's talking about? If you have a question about it, you can, okay, I'm getting a no. All right, can you give a little bit more information on that, Vicki, so they know?
Yeah, so it's basically what we call it as a non-recurrent short-term payment, and it's a payment that is intended to help our TANF families be able to prepare for the seasons to purchase clothing items, such as the May one is intended for summer. Then there's one for fall and winter clothes. So it's to help families be able to meet those needs.
All right.
So the other question in the chat, there will be a letter that will go out to the TANF family if they're going to be receiving that.
Thank you, Vicki. All right, I know that we are almost at the end of our meeting here, but we do have a guest here who is hoping to present a quick announcement during the open forum time. So I would like to hand it over to Mary Ann to go ahead and discuss that piece. But I do see there are some more questions in chat. So if there are folks online that can help address those, that would be wonderful. Mary Ann.
Hi, everybody. Thank you so much for letting me visit your meeting today and make an announcement. I'm a professor at Western Oregon, And my class of students this term is partnering with the City of Salem Human Rights Commission and doing a survey project. And we are working to get the link out to people about that survey. It will take about 5 or 10 minutes. You have to be 18 or over and live or work in or within 20 miles of Salem. So any of you that qualify, we would love to have you take a few minutes. There's a link that goes to the survey in English and a link that goes to the survey in Spanish. And I've put that information in the chat. We'd love to have you complete it. If you have people you're working with, you're welcome to share it. We are looking for a wide range of voices, all walks of life and perspectives from the Salem and surrounding areas. Thank you.
Thank you. Hey, we did pretty good. We're only 1 minute over. We had a lot of information today. Thank you all for being here. If you didn't get your question answered in the chat, I will try to find answers for you and get back to you. So I do see there's a couple of things in there. So thanks again for being here today, and have a great day. We'll see you next time.